Her finger was hovering over the discharge button when the charge nurse walked up behind her. "Amanda, before you do that, look at page 4 of his file." What Amanda Brooks saw next would haunt her for years. What this ER nurse didn't know about the quiet man in bed 7 would change how she saw pain forever. Watch what happens when you judge a veteran's suffering. Type respect. If you believe everyone's pain deserves to be taken seriously. His name was William Chen, 52 years old. And on this Friday night, in a crowded Seattle emergency room, he was fighting a battle he thought he'd left behind in Afghanistan. The fluorescent lights hummed overhead. Bed 7, third curtain from the nurse's station. William sat perfectly still, back straight despite the pain radiating from his left leg. The prosthetic was off, leaning against the wall. His stump was swollen, infected. Red streaks climbing toward his knee. He'd waited 6 hours. Said nothing. Asked for nothing. Just sat there with his jaw set, breathing through it. Nurse Amanda Brooks had been on shift for 12 hours. She was tired, irritable, and she'd seen 3 suspected overdoses already that night. When she finally pulled back the curtain to bed 7, her mind was already half made up. "Mr. Chen, you're here for leg pain?" William nodded once. "Yes, ma'am. On a scale of 1 to 10. 7, maybe 8. Amanda's expression didn't change, but something flickered across her face. Skepticism. She'd heard it before. Everyone was always a 7 or 8. Never a 6. Never a 9. Always the sweet spot that got you the prescription pad. And when did this start? 3 days ago. 3 days? Her tone sharpened. Why didn't you come in sooner? William's jaw tightened. Just slightly. I've dealt with worse. That was his first mistake. Never tell an ER nurse you've dealt with worse. It sounds like bravado, like you're minimizing, or setting up the ask. Uh-huh. Amanda was typing now, not looking at him. Any allergies? No, ma'am. Previous pain management. Ibuprofen over the counter. And that's not working anymore. There was an edge to her voice now. William caught it. 20 years in the army teaches you to read rooms, read voices, read the space between words. No, ma'am, it's infected. I need antibiotics. Maybe someone to look at. I'll be the judge of what you need, Mr. Chen. The curtain swished closed. William sat there in the sudden silence. His leg throbbed, a deep hot pulse that ran from his stump up into his hip. He knew infection. He'd seen it before. Smelled it before. This was bad. This needed treatment, but he didn't call out, didn't complain. That's not how he was built. 30 minutes passed. An hour. The pain climbed from an 8 to a 9. William's hands gripped the edge of the bed. His breathing was measured, controlled. In for 4, out for 4, the way they taught you, the way you survived. When Amanda finally returned, she had that look. The one nurses get when they've decided you're wasting their time. "Mr. Chen, I've reviewed your chart. You're not running a significant fever. Your vital signs are stable. I think what you're experiencing is normal phantom limb pain. It's very common in amputees. It's not phantom pain." His voice was quiet, steady. "It's infected. You can see the streaking, the swelling. I'm sure it feels that way to you." Patronizing now. But phantom pain can be very convincing. The brain creates sensations that aren't really, "I know what phantom pain is, ma'am. This isn't that." "Are you a medical professional, Mr. Chen?" Silence. "I didn't think so. Now, I can prescribe you some gabapentin for the nerve pain, or I don't want painkillers. I need antibiotics. I need someone to look at the infection before it spreads." Amanda's patience snapped. She'd been dealing with difficult patients all night. Drug seekers, frequent flyers, people who thought Google made them doctors. And now this man, sitting there with his military bearing and his quiet intensity, telling her how to do her job. Mr. Chen, her voice was ice. I see this every single day. People come in here, they have a story, they need their fix. The leg pain, the back pain, the migraines, always something invisible, always something they insist is severe, and they always push back when we suggest non-narcotic options. William's hands tightened on the bed rail. His knuckles went white. I'm not asking for narcotics. Then what exactly are you asking for? Treatment for the infection. What I see is a man with stable vitals trying to convince me he's in crisis. I see someone who waited 3 days to come in, which suggests this isn't actually urgent. And I see someone who's getting hostile when I won't immediately prescribe what he wants. I haven't asked for anything except antibiotics, which you've decided you need based on your own diagnosis. That's not how this works. She was pulling up the discharge screen now. I'm going to recommend you follow up with your primary care physician on Monday. If you're still experiencing discomfort, they can... Discomfort? William's voice didn't rise. That was the thing. It stayed perfectly level, but something in it changed. Something that made Amanda pause. Ma'am, I'm trying very hard to be respectful here, but I'm telling you this is serious. And I'm telling you that I've been a nurse for 15 years. I think I know the difference between a genuine emergency and... Amanda. The voice came from behind her. Charge Nurse Patricia Kim, 30 years in emergency medicine. She'd been listening from the station. A word, now. Amanda followed Patricia to the nurse's station, irritation rolling off her in waves. Patricia, I've got this. He's clearly seeking. The story doesn't add up. He's pushing for specific medications, and his vitals don't support. Have you looked at his full medical history? I glanced at it. Amputee, service-related. Probably got hooked on pain management during recovery, and now... Page 4, Amanda. Look at page 4. Patricia pulled up the file on the screen. Scrolled down, found the section. Her finger landed on a paragraph in the surgical history. A single entry from 15 years ago. Amanda leaned in, started reading. Her face went white. Oh, God. The words on the screen were clinical. Dry. The kind of medical documentation that strips horror down to facts. But the facts were enough. Emergency field amputation. Self-performed. Patient severed own left leg below knee using combat knife following traumatic crush injury from IED blast. Procedure performed without anesthesia. Patient remained conscious throughout. Subsequently carried 2 wounded personnel 12 miles to extraction point. Leg preserved in makeshift tourniquet fashioned from belt and rifle strap. Patient remained conscious and alert upon extraction. Field medics report patient walked to helicopter unassisted before collapsing. Amanda read it twice. 3 times. The words didn't change. Self-performed amputation. Combat knife. No anesthesia. 12 miles. Her hands were shaking. That's not... She couldn't finish the sentence. That's not possible. It's documented by 3 different field medics. Confirmed by the surgical team at Bagram. There are photographs in the classified section. Patricia's voice was quiet. He cut off his own leg, Amanda, with a K-bar knife, and then he walked 12 miles carrying 2 rangers who couldn't walk themselves. Why would he? Amanda's medical brain was trying to process. The pain alone would be unsurvivable. That's what the report says. Unsurvivable pain threshold. The surgeons at Bagram called it physiologically impossible. But there he was. Conscious. Alert. He had to be sedated by force so they could treat him because he kept trying to check on his men. Amanda turned to look at bed 7. William sat exactly where she'd left him. Upright, breathing controlled, hands steady on the rail. The man who'd cut off his own leg in the desert was sitting in her ER with an infection, rating his pain a 7, and she'd called him a drug seeker. Oh, God, she whispered again. Patricia's voice was gentle but firm. When a man like that tells you he's in pain, believe him. Because if he's admitting to a 7, it means normal people would be screaming at a 15. Amanda walked back to bed 7. Her legs felt unsteady. She pulled back the curtain. William looked up. His face was gray now, sweat on his forehead. The infection was spreading fast. She could see it. How had she missed it? How had she looked at those red streaks and dismissed them? "Mr. Chen," her voice cracked. "Sir, I need to apologize. I was wrong. I was so wrong. I didn't." "It's all right." His voice was steady, forgiving, like he'd expected this, like he was used to not being believed. "It's not all right." Amanda was blinking back tears now, professional facade cracking. "You've been sitting here for hours, in pain, real, serious pain, and I accused you of... You didn't know." "I should have known. I should have looked. I should have listened." She was pulling up his chart, ordering tests, calling for the attending. "We're getting you antibiotics immediately. IV push, and someone needs to look at that stump. It might need surgical debridement. Dr. Martinez is the best we have. I'm getting him down here now." "Thank you, ma'am." That's what broke her. The gratitude, after everything, after hours of being dismissed, accused, judged. He was thanking her. "Why didn't you tell me?" The words came out before she could stop them. "Why didn't you just tell me what you'd been through?" William was quiet for a moment. Then, "Would you have believed me?" She had no answer for that. Dr. Martinez arrived 12 minutes later. He read the chart. His eyebrows climbed higher with every line. He examined William's leg with a reverence that bordered on awe. "Colonel Chen, sir, this infection is serious. You should have come in 2 days ago." "I know, Doc. I waited too long. The pain must be significant. It's manageable." Dr. Martinez glanced at Amanda. They both knew what manageable meant from this man. "We're admitting you. IV antibiotics, possibly surgical cleaning. This could be septic if we're not careful." "Understood." "And Colonel," Dr. Martinez extended his hand, "I read your file, all of it. What you did for those Rangers, Sergeant First Class Kowalski and Specialist Ramirez. They both made it home because of you. Kowalski's my wife's cousin. He's got 3 kids now. They wouldn't exist if you hadn't..." William shook his hand, said nothing, but something in his face softened. Amanda stood there watching, learning, understanding how badly she'd failed, not just as a nurse, as a human being. Over the next 3 days, William Chen received treatment. The infection responded to antibiotics. The wound was cleaned. He was discharged on day 4 with proper medication and a follow-up schedule. On his last morning, Amanda came by during her shift. She'd been avoiding bed 7. Shame keeping her away. But she needed to say something. "Mr. Chen, before you go, I need you to know. I will never forget this. I will never assume again. I will never dismiss someone's pain. You taught me something I should have already known." William was strapping on his prosthetic. He looked up at her, and for the first time, he smiled. Just slightly. "We all make mistakes, ma'am. The measure isn't the mistake. It's what you do after." He stood, tested his weight. The leg held. "You'll be a better nurse now. That's what matters." He walked out of that ER with the same quiet dignity he'd walked in with. But Amanda Brooks was different. She tells that story now. In training sessions, in orientation, to new nurses who think they've seen everything. Pain isn't just what you can measure. It's what people carry. And some people carry so much more than we'll ever know. Some people cut off their own leg in the desert and walk 12 miles to save their brothers, and then sit quietly in an ER for 6 hours because they were raised to never ask for more than they absolutely need. Judge carefully. Listen closely. Because the quietest people often carry the heaviest stories, and real strength doesn't demand recognition. It simply endures. If this story moved you, wait until you hear what happened when a janitor was accused of stealing from a military ceremony. What he pulled from his pocket shocked everyone. Type honor in the comments if you believe veterans deserve our respect and our trust. Subscribe to Never Forgotten Stories for more accounts of hidden heroes who earned everything and asked for nothing. And hit that like button if you think every patient deserves to be believed. Share this with someone who works in healthcare. They need to remember